So myself, Dr. Prayrna Sharma. I'm working as a senior consultant physician in HCL Healthcare, Noida. And today I will be talking about diabetes mellitus and its linkage to the muscle disorders. So diabetes mellitus is a metabolic disorder which occurs because of the prolonged hyperglycemic state due to insulin resistance or defects in the insulin function. So diabetes mellitus, generally it affects the glycosylation of the proteins, and it affects the microvascular abnormalities, which can lead to defects in the muscles, bones, nerves. And because of these abnormalities, so this can cause multiple manifestations, like it can cause muscle cramps, it can lead to diabetic myopathy and peripheral neuropathy. And apart from that, there is osteoporosis and osteopenia, and frozen shoulder, as well as carpal tunnel syndrome. So all these manifestations, generally diabetic patient, they have more tendency of having fractures as compared to a non-diabetic patient of the same age group. So these manifestations, like we need to identify it early and get a doctor consultation early. So the symptoms, generally it occurs like there will be a muscle cramp, or there will be a tingling or numbness of the hands and feet, and it might lead to like myopathy. So there will be a difficulty in walking, or there will be a difficulty in standing from the sitting position. So all these affects the proximal muscles. And apart from that, like the patient might feel difficulty in combing the hairs. So all these things the patient need to identify and consult the doctor. And uh, the best way to avoid this complication is to have a good glycemic control. So we have to go for a lifestyle modification, physical activity, along with the diet control, as well as we have to take the medications appropriately, so that we manage our blood sugar levels normal, and do the regular self monitoring of the blood sugar, so that we can maintain our HbA1c below 7. So apart from that, controlling the sugars, the next is to regularly do the physical activity, so that our muscles becomes more active, and we can maintain our weight also. So because the overweight, obesity, all these things can lead to arthritis and osteoporosis. So we need to maintain that. And if these symptoms arise, then the acute management can be done with a doctor consultation, because different diseases have different symptoms, and accordingly we have to go for further investigations if needed. And the patient can take anti-inflammatory drugs or painkiller over the counter of the medication from the acute conditions. Or the important thing is to take vitamin D supplements, calcium supplements, along with B12 supplements. And then regularly don't miss your symptoms. Go to the doctor, consult your doctor, and if they are diagnosed early, then they can we can avoid complications in future. So identifying these symptoms and proper consultation and appropriate management is important. So the takeaway is, identify your symptoms, take regular balanced diet, lots of fluids, take regular medication, control your blood sugar, and consult your doctor as early as possible.